Excuse me, please. Do you know what a cardiovascular perfusionist is? He repairs the heart? Someone who makes instruments for heart surgery? He makes films about the heart? Oh, I would say he goes around with a cardiogram to check the heart rate.
Cardiovascular perfusionist. Something in the hospital? Cardio? No, it could have something to do with the heart. The daily routine in a hospital with all of its different departments is for most people a confusing chaos. Many people are familiar with the terms specialist physician, surgeon, and nurse. But what is a cardiovascular perfusionist? Could have something to do with the heart. Yes, the basic premise is correct, but strictly speaking, this profession doesn't really exist. The German Society for Cardiovascular Engineering has been fighting for years for recognition of the cardiovascular perfusionist's occupational profile. It is about time that this position, with its enormous responsibility and complex activities, is officially recognized as a profession. The human heart is a high-performance organ. It beats about 100,000 times a day, thereby pumping about 10,000 liters of blood through our body. If our heart is sick, it needs help. Our body depends on its perfect function. At the beginning of the 1950s, the very first operations on a stopped heart became possible. Thus, up until today, hundreds of thousands of people could be saved from certain death. The development of extracorporeal blood circulation created a demand for specialists who could operate a heart-lung machine and monitor circulatory function during surgery. Since the beginning of modern cardiac surgery, the perfusionist has been an essential part of the open heart surgery team. Over many hours, the monitoring and regulation of the patient's vital functions are in their hands. The perfusionist's range of tasks has constantly expanded to keep pace with the rapid development of modern cardiovascular and thoracic surgery. Today, it has actually reached the point where it encompasses a wide interdisciplinary specialist field. During the early morning conference of Dr. Franke's team, the surgery schedule is discussed. Also, details concerning the use of the heart-lung machine will be coordinated, which the senior perfusionist will then pass on to his colleague in the operating room.
Dann berichte mal von der Frühbesprechung. Wie viele Betten haben wir dann auf der H9?
Auf der Station 1D sind nur 5 Patienten heute besprochen worden.
Today, 5 cardiac operations requiring the aid of the heart-lung machine are planned. The first patient is suffering from mitral valve insufficiency. The valve's function will be restored with the help of minimally invasive surgery. Using this technique, it is not necessary to split the sternum. This reduces the patient's operative stress and shortens his convalescence. The heart-lung machine will be connected in this case via the femoral blood vessels, the leg arteries and veins. During the operation, the perfusionist, with the help of the heart-lung machine, ensures the maintenance of the patient's circulatory functions. The machine replaces the pumping function of the heart, thereby safeguarding the blood supply to the body and the brain. The machine also takes over the lung function with the help of an oxygenator. The blood flows over a special membrane where it is cleared of carbon dioxide and enriched with oxygen.
Durch die permanente Weiterentwicklung der Herz-Lungen-Maschine
The use of the heart-lung machine and its system components has become very safe as a result of ongoing development. However, the informed medical and technical knowledge of an expert, that is, a perfusionist, is necessary in order to use this machine.
in den letzten Jahren
In the last years, the physical condition of the patient population has continuously deteriorated. This has been caused, among other things, by an increase in life expectancy. The never-ending advancement of heart surgery allows for increasingly sicker people to be operated upon. Thus, the perfusionist constantly faces new challenges as he is confronted with more and more complex operations.
In general, for every scheduled cardiac operation, a heart-lung machine with a sterile tubing set made out of biologically compatible synthetics is prepared and pre-filled with an electrolyte solution. For safety reasons, the tubes can only be used once. The tube system is connected with special venous and arterial cannulas, which are placed by the cardiac surgeon according to the operation technique over the open thorax to the aorta and the collecting veins, or to the inguinal vessels.
Okay, an die Maschine bitte, Vene ist frei.
wenn die Herz-Lungen-Maschine die komplette
When the machine has taken over the patient's entire cardiovascular function, it is especially important that enough oxygenated blood is pumped into the patient's circulatory system. Of course, air cannot be allowed to enter into the patient's blood vessels. This would have catastrophic consequences. The management of the heart-lung machine demands the perfusionist's full concentration on patient, machine, control systems, monitors, and most importantly, on the exact coordination of the sequence of actions with the cardiovascular surgeons, the anesthesiologists, and the entire surgical team.
The perfusionist induces an artificial cardiac arrest by using the so-called cardioplegia technique. This is done with the help of a special solution, which is administered directly into the heart through the heart-lung machine. The goal of this procedure is to protect the heart during surgery. Blood-thinning medication is given for the regulation of coagulation. In Stuttgart on this morning, a minimized heart-lung machine is being used. The reduced filling volume is intended to keep the blood dilution caused by the machine as low as possible. The advantage for the patient is that a blood transfusion may not be necessary and that with less blood dilution, recovery is faster. In comparison, the second cardiac operation in Stuttgart by a standard system. This requires a considerably larger filling volume and therefore results in more extensive blood thinning, although it is the safer method for certain operations. Depending on the surgical technique and the medical condition of the patient, the system which can best fulfill the patient's needs is the one that is used. In Coswig on the Elbe, the surgical team has prepared for a bypass operation. The 60-year-old patient was admitted as an emergency a few hours ago, a situation recurring on a daily basis in Germany.
die sichere operative Sofortversorgung
Safe surgical emergency care in all German cardiac surgery hospitals can only be guaranteed when emergency teams are available day and night, ready for action within minutes.
letztendlich auch für den Cardio
For the perfusionist, this leads ultimately to additional stress as a result of on-call duty, emergency duty, and permanent overtime. From this perspective, it is quite remarkable to see the degree of dedication the perfusionist devotes not only to the performance of his job, but also to the advancement and improvement of machines and operating techniques.
At the Gießen University Hospital, they are also working on the development of special treatment techniques and forms of therapies using the heart-lung machine. The chemotherapy treatment for a patient with an abdominal carcinoma has been scheduled for today. With the so-called HIPEC procedure, the hyperthermic intraperitoneal chemotherapy, the fact that tumor cells are more heat-sensitive than normal healthy cells is utilized. The skill and experience of the perfusionist are of particular importance when using this therapy. The heart-lung machine pumps a heated, up to 42 degrees Celsius, highly effective anti-cancer medication directly into the abdominal cavity, thereby destroying concealed or surgically inaccessible tumor cells. This way, the concentration of the cytostatic agents can be much higher than with the use of an intravenous infusion, thus greatly increasing the chances of therapeutic success.
In den letzten Jahren
In the past years, technique and treatment procedures in cardiovascular surgery have developed at a rapid pace. The perfusionist has contributed to these developments through dedication, commitment, and above all, professional competence. This clearly illustrates the need for an established training program and the creation of educational standards, thereby ensuring the preservation of this high level in the future.
In the meantime, there are many centers in Germany offering a qualified education in the medical specialty field of cardiovascular perfusion. In addition to theoretical expertise, practical training is an especially important fundament for a future career. For this reason, instruction also takes place in a teaching operating room especially equipped for this purpose, thus providing practice-oriented training under realistic conditions.
Wann entlüften Sie denn die Kardioplegie dann?
Professor Dr. Gerd Heimel is the Director of Studies for Medical Engineering at the Furtwangen University.
Genau. In Bezug auf die Ausbildung ist es uns sehr wichtig.
With regard to training, it is very important to us that we create a university education as a basic requirement for the work of the future cardiovascular perfusionist.
Die Kardiotechnik wird in der Zukunft ein Dienstleister sein.
In the future, cardiovascular engineering will be a service provided for different departments in the hospital.
Sondern in Zukunft wird sich
It will not only be limited to heart surgery, but will also be used in the areas of general surgery, tumor surgery, and pulmonology, thereby contributing significant new aspects to other fields.
in der Zukunft in anderen Bereichen setzen.
The Academy for Cardiovascular Perfusion in Berlin was founded on the initiative of Professor Dr. Roland Hetzer. It offers a 4-semester perfusionist training program with an officially recognized qualification for the state of Berlin. In addition, in cooperation with the Steinbeis University, a 3-year program for a Bachelor of Cardiovascular Perfusion is offered.
Die Aufgabenbereiche der
In the last years, the perfusionist's range of functions has become increasingly more diverse and demanding. This is an enormous challenge, but it also provides the chance to individualize the career structure. For this purpose, it is necessary to determine clear official educational guidelines in order to enable the individual to plan his career structure. For only with appealing professional prospects, we will be able to motivate sufficient young talent for an education as a perfusionist in the future.
The use of simulated operations is also an important part of the curriculum here.
Okay, danke. Jetzt mal Stopp.
Up until now, the perfusionist education consisted of different paths and standards of training. Most of the perfusionists working in Germany today are certified by the European Board of Cardiovascular Perfusionists. In order to assure standards of quality, the certified qualifications are re-examined every 3 years. All men and women have one thing in common. Despite their diverse educational paths and qualifications, all perfusionists work under the same occupational title, however, without official recognition of their profession.
Die Wünsche der Herzchirurgie in Bezug
There is clearly considerable support from the side of the heart surgeons regarding the official recognition of the occupational title Cardiovascular Perfusionist, because the perfusionist range of duties is becoming more and more complex and increasingly more fields are being covered by cardiovascular engineering. For this reason, official recognition of this occupational title is vital.
Besonders im Interesse
Especially in the interest of all affected heart patients, we find it absolutely necessary to finally give the perfusionist professional recognition. This is the only way to secure a consistently high level of care for the patient. Unfortunately, political demands to create the prerequisites for this purpose have been until now generally unsuccessful.
The motivation for this career choice is for many perfusionists to be a combination of interest in technical education, future professional prospects, and above all, the wish through one's work to make a positive contribution to society, whether it be work in the operating room or in the development of new medical technologies.
Besonders der Bereich mit den Kunstherzen.
Especially the field of artificial hearts offers the opportunity to stay in contact with the patients and to work with them on a personal basis. This is a little bit different than standing in the operating room where one deals exclusively with the technical side of things. It is really important to me to have human contact, and here are good opportunities to help patients. In the intensive care unit of the University Hospital Regensburg, doctors and nursing staff are fighting for the life of a young man. A dramatic accident, having occurred on a nearby highway a few hours earlier, requires the fastest possible care for the critically injured patient. In this case, the necessary helicopter transport could only be carried out using a circulatory support system. This system is a small, transportable heart-lung machine that can ensure the survival of the patient in this kind of emergency situation. Up until a few years ago, helicopter transports of such critically injured patients would not have been possible.
Ein Problem der Vergangenheit war, dass ECMO-Systeme.
One problem in the past was that the ECMO systems, because of their size and weight, were much too large to fit in a helicopter.
Dadurch war es nicht möglich,
As a result, it was not possible to treat these patients off-site with a mobile unit and to transport them to a maximum care center.
zu transportieren. Die Catheter-Technik
Cardiovascular engineering has played a decisive role in miniaturizing these systems in the past years, thus making it possible for them to be used as a suitable instrument in air rescue and emergency medical services.
eingesetzt werden können.
In addition to on-site work, the maintenance and monitoring of the ECMO, the extracorporeal membrane oxygenation, in the intensive care unit also belong to the responsibilities of the perfusionist. This therapy is used for patients with severely damaged lungs. All over the world, people are striving to ensure the survival of cardiac patients or the severely injured. In these circumstances, minimized cardiac support systems are used with increasing frequency. This would not be possible without a perfusionist. The perfusionist's range of activities reads like an aviation pilot's checklist. Therefore, a professional training program is extremely important.
Die Ausbildung der Kardiotechnik sollte vereinheitlicht und strukturiert sein.
The training of the cardiovascular perfusionist should be standardized and structured. I would be happy if one could assume that nationwide or even Europe-wide, when people carry the occupational title of cardiovascular perfusionist, one can be sure that they all have the same professional background.
Hintergrund besitzen.
This is not yet the case, I think, neither nationwide nor Europe-wide, although there are many different certificates available. For this, a standardized educational structure is necessary.
Ist notwendig.
The German Society for Cardiovascular Engineering is the professional organization of cardiovascular perfusionists. It offers advanced training and continued education and has been fighting for many years for the official professional recognition of the perfusionist. All members meet once a year for a conference. Varying scientific topics with presentations and discussion forums provide the opportunity for a professional, interdisciplinary exchange of ideas. For many years, industrial companies, which are highly specialized in this field, are represented with information stands at conferences. A good opportunity to get to know new developments and medical products in the area of cardiovascular engineering. In addition to the yearly conference of the German Society for Cardiovascular Engineering, also meetings of the Executive Board take place where administrative and organizational topics are discussed. In additional closed-door meetings, cardiovascular engineering department heads working in groups prepare continuing education topics for imparting professional knowledge. Also covered are, for example, questions of labor laws and laws pertaining to work hours and overtime, as well as current information on the topic of professional recognition. Every year throughout Germany, also approximately 4,000 children with congenital heart defects are operated on with the help of the heart-lung machine. These operations require an especially high level of professional expertise and sensitivity from the perfusionist, as children are physiologically not just little adults. They react in many cases to certain treatments in an entirely different way than adults do. This small patient suffers from a congenital heart defect, a hole in the cardiac septum, which will be closed today. After the successful operation, the little patient can live a normal life, as if the small hole in his heart never existed. There is hardly a medical discipline that undergoes such a rapid degree of change as cardiac surgery. This confronts the very small occupational group of the perfusionists with the very big challenge of living up to the expectations of constantly changing demands. An example of this is the catheter-supported heart valve operation. With this procedure, a foldable heart valve is deployed over a catheter system. This operation can usually be performed without the use of a heart-lung machine. There is, however, during this surgical procedure, always a perfusionist in the operating room. To his tasks here belong preparing the heart valve for implantation and having a fully operational heart-lung machine available in order to be able to connect the patient immediately and stabilize his circulation in an emergency. Meanwhile, it has become routine to use a perfusionist when implanting a cardiac pacemaker. This calls for a high level of competence in cardiological diagnostics in order to optimally adjust the technical parameters of the pacemaker to the individual needs of the patient. The enormous responsibility for the life of the patient is particularly demonstrated with the AICD therapy. Patients with cardiac dysrhythmia can suffer sudden cardiac death. This is avoided by implanting a small defibrillator. With the use of artificial heart systems, an acute or chronic cardiac failure can be successfully treated. Additionally, they can help bridge the waiting period until a heart transplantation is possible.
Without the support of an artificial heart system, today many patients would not have any chance of survival. In the meantime, artificial heart systems have become so safe that they can also be used as an alternative to heart transplantation. The advantage for the patient is that he can be discharged from the hospital and can participate in a normal life again. For the critically ill patient, this means a big gain in his quality of life.
Ich denke, es ist nur gerechtfertigt, dass man auch älteren Menschen...
I think it's only justified that older people can also be given a few more years with a good quality of life.
In Zukunft
In the future, we will use such systems also in disorders which until now we have not yet taken into consideration. Biventricular cardiac failure in patients with contraindications for transplantation, also end-stage congenital heart defects, for example all of the patients that have a transposition of the large vessels, in whom eventually the ventricles fail, and also the large number of patients who develop a right ventricle heart failure, for example in pulmonary vascular disorders, primary pulmonary hypertension, etc. For these, there are no other treatment concepts available.
Gibt es ja sonst keine Behandlungskonzepte.
Apart from the technical qualifications, the care of artificial heart patients requires an exceptionally high degree of sensitivity and compassion. The 6-year-old Lara has been waiting for over 2 years for a donor heart. Her survival since then has been ensured by the so-called Berlin heart, a pneumatically powered circulatory support system. Lara's range of motion is restricted by an approximately 2 meters long air tube between the machine's engine and the blood pump worn on her body. Today, Lara is looking forward to an outing to a botanical garden near the hospital. The perfusionist prepares the engine's console and accompanies Lara and her family on the outing. This way, in the event of an emergency, somebody is immediately there to help with a potential problem. This outing is also something special for him, because he is able to treat Lara and her family to such a welcome change from the otherwise relatively stressful daily routine in the hospital.
So, wunderbar. Guck mal, und das bringen wir dem Pfleger mit, ne?
When parents or patients say to me, "Only because of your work I'm still alive today, I am able to deal so well with my disease," these are moments that tell me it was worth it to have looked after the patients for days, nights, weeks or months, and also to have built up a personal relationship with them. When I can help people with my knowledge, I'm always prepared to do so and hope that with this, I can also further our cause. For me, being a perfusionist is a real calling.
As he accompanies little Lara along a part of her life's path, so his perfusionist colleagues daily accompany the patients entrusted to their care in all of Germany's cardiac hospitals. Perfusionists, for whom their job has become a profession for life and who draw strength out of a vocation that should finally find professional recognition.